Welcome back to Normalized PTSD. Today we have Dr. Fredman. She's going to talk about interpersonal relationships. As you imagine, PTSD it doesn't impact just the person; it impacts everybody around them. So this is going to dive down into things that you can do to help, things you can do to support, as well as signs, symptoms, and maybe signs and symptoms of things that you're doing that may not be helpful. So, with no more delay, I hope you guys enjoy this one. Today, we're met with Dr. Fredman. Thank you so much for joining. And if you could just take a moment to, tell us a little bit about yourself and how you got involved with helping with PTSD.
So I'm a clinical psychologist by training. I'm currently at Penn State. I'm an associate professor of human development, family studies, and psychology. My interest is in the intersection between individual mental health and couple functioning. And my particular focus is post-traumatic stress disorder, PTSD. And I'm really interested in understanding how PTSD affects couples' relationships, how aspects of the couple relationship can either facilitate or impede recovery from PTSD. And then really particularly passionate about developing and testing and importantly disseminating couple-based treatments for PTSD that simultaneously treat the disorder as well as enhance intimate relationship functioning.
Intimate relation function. I read that a couple of times in the journals that you provided. Could you describe what that really means?
Sure. So intimate relationship functioning would kind of refer to people's close relationships. My most of my work to date has been looking at PTSD situated within a couples, like a romantic couples context.
Mhm.
But we've also done work looking at how PTSD can impact parenting, how it can impact co-parenting. So how the trauma survivor with PTSD makes decisions about parenting the child that they share with their co-parenting, as well as how that can happen, both that can occur even when people are no longer in a relationship together. But if you've had a child together, you have a relationship with this person for the rest of your life. And so it's really important that people can be effective co-parents,
Right.
even if they're no longer romantic partners. And then when we're talking about intimate relationship functioning, that can also be kind of broader family functioning, like how people get along with their siblings, how they get along with their their parents, even if they're adults, how they, are relating to members of their extended family and broader community.
Okay, so we're going to talk a lot about families. But is it
Mhm.
safe to say that a lot of this can be applied to friendships too? Because some of us don't have the wife or the kids, and those that are listening, I feel like a lot of the interpersonal relationship aspects are similar in friendships too, like close friends.
I 100% agree. And actually, that's why in the treatment that we'll, I guess, be talking about later, cognitive behavioral conjoint therapy for PTSD or CBCT for PTSD, the reason we called it cognitive behavioral conjoint
Hmm.
therapy instead of cognitive behavioral couple therapy, even though most of our research to date is on romantic couples, is that we were anticipating its broader application to
Right.
non-romantic dyads. And we have had success in working with dyads that are siblings, that are friendship pairs, because a lot of the same principles apply.
Okay. Awesome. That's what I was hoping to hear. So
Mhm.
we'll just touch on some of the journals first. I see that there's a 15% to 23% rate of PTSD that's been identified in veterans. Uh, do you have any qualifiers that may like indicate why that number is so high, or maybe why it's not 100%,
Yeah, and actually, that number refers to people who meet a full diagnostic criteria. That number may be even higher when you're talking about people with subthreshold or subclinical PTSD.
Right.
But of course, not as you touched on, not everybody develops PTSD.
Hmm.
So there are lots of reasons that people may or may not go on to develop PTSD. Um, the three that we target in our cognitive behavioral conjoint therapy for PTSD. And that is also what tends to be targeted in individual evidence-based treatments for PTSD, like cognitive processing therapy and prolonged exposure, are whether people, how much people avoid after exposure to their trauma, whether they numb out
Mm-hmm.
um, and try to not feel their feelings versus they allow the feelings to come and then naturally subside. And then a third major factor is how people think about the traumatic event. So, are they able to tell a story about what happened and why in a way that makes sense?
Mm-hmm.
And then, from an interpersonal perspective, we know that social support around the time of trauma and in its acute aftermath is one of the most robust predictors of whether someone will go on to develop PTSD. And one of the thoughts about why that is that having social support and close relationships with other people seems to promote the development of what we call a cogent trauma narrative. So, again, getting back to the idea of if I feel supported by others and I'm not judged, I'm more likely to spontaneously start talking about what happened to me. Um, and as I'm talking about the meaning behind the event, so it's less important that people are talking about, this happened and then that happened and sights and sounds and smells, but more big picture meaning, like why did this happen? And whose fault was it? Was it my fault? Was it somebody else's fault? Was it something that could have been avoided? Was it random? Was it an accident? What sort of factors were at play that contributed to this? That having social support and feeling comfortable disclosing, you're thinking about the event seems to help people be able to ultimately be able to tell a story that makes sense to them, and then they'd be less likely to develop PTSD.
That's an interesting concept. I know from my background, it was in the military. There's a really big stigma about PTSD, and it's negative for the most part. Whether it's
Mhm.
you can be found unfit for duty, and then I know one person, he went to get help, and within a month, he went from active duty to medically retired. So like the transition's
Mhm.
fast and can be. So I feel
Yeah.
like if there's that negative aspect to it, then it makes it hard to open up and communicate about it.
Yeah, it's really unfortunate how much stigma there is about that and how people may be sort of forced out with that disclosure.
Yeah.
I'm part of a research consortium that is based out of San
Hmm.
Antonio at the University of Texas Health Science San Antonio through a consortium called Strong Star. And they have developed a great relationship with some of the local military bases where commanders will actually are very supportive and facilitative of service members getting treatment, and that actually, and there's a recognition that that actually enhances fitness for duty. And I think the military is increasingly recognizing that allowing people to get help, and it actually helps us to retain a strong and healthy fighting force.
Right. It's one of the things I was going to talk about with the CBCT. I was like, wouldn't it be an interesting concept if that was mandatory training, like post-deployment training for someone that comes back and returns home? It's like I was trying to put it in like some sort of I don't know, light, like a different light. Like if 25% of people that rode a bicycle or high risk of suicide, don't you, unless they went to a 15-week course, don't you think everybody would be mandatory to go to the 15-week course? But the fact that it's just a little bit different in the military, we prioritize physical health and, training, but not so much mental health and mental training. And I feel like that's a huge aspect that is kind of missed out on.
Mm-hmm. Yeah, and the military has been investing in family programs to support families during the course of the deployment cycle, including when people return home and trying to promote reintegration. And those programs would be what we call universal, so they would be applicable for all comers. You don't necessarily have to have PTSD.
Hmm.
And what we know is people being in a supportive social network, whether that's their family, friends, extended family, et cetera, and if they're kind of going about their life and engaging in activities meaningfully, and they're not avoiding, that should promote their mental health and make it less likely that they'll have PTSD.
Right. So, this podcast is for first responders a bit too, and I feel like I hit a lot on veterans all the time. And when I look at the, I guess the support structure for veterans, though I have some beef, like I think that there's things that can be improved. There's still a really big, significant support structure there for veterans, whether it be benefits or resources available for them. I don't really see that so much in the civilian side for, say, police officers, nurses, and things of that nature. Do you know any groups or organizations that are trying to help those groups a little bit on this same topic? Because one of the big problems is the only way they can get medical help and support is with insurance, which is directly associated with their employment, which, if they're found unfit for duty, then they lose their employment. And I'm just
Mhm.
like, dang.
Yeah, in fact, Dr. McLean, I think, would be a really good resource for this because she has a grant that I collaborate with her and her colleagues on that's actually through FEMA to
Okay.
support, to test like an intensive treatment for firefighters who have PTSD, insomnia, and nightmares. And I think there's actually been a lot of support from the fire service
Right.
for this. And so I think kind of recognizing, because they're training and they're doing their job in groups. And so one
Mhm.
of the thoughts too is delivering treatment intensively and in groups also would be sort of culturally sensitive and responsive.
Okay, awesome. I'll reach out to her and see if she'd like to talk about that.
Mhm.
Okay, so now we're going to dive into it. So if I'm someone who's listening and I'm like, I think I may have PTSD. Like, what are some ways to go about to identify one, do I have it? Or like, how do I find out if that's a thing? And then two, how do I see if it's impacting my relationships in a negative way?
Mhm. Well, so one resource that I would point your listeners to is the National Center for PTSD. So if you just Google National Center for PTSD, the website will pop up, and there's lots of really great education and screening materials to help people figure out if they might have PTSD, as well as links and resources for family and friends to support individuals who might have PTSD. One thing I think is really important to keep in mind is that exposure to trauma is very, very common. So in North America, um, like over 80%, maybe even closer to 90%, depending on which study, of adults have been exposed to at least one traumatic event in their lifetime. And in many cases, it's more than one.
Hmm.
Um, but as we talked about, not everyone goes on to develop PTSD. We know that rape and combat are the two types of trauma that are most likely to lead to the development of PTSD, potentially because they're so interpersonally oriented in that people are trying to um, people are experiencing harm at the hands of another person. But I would also note that even traumas that seem to be, not trying to necessarily inflict harm on another person, like if people are in a car accident or if they experience a natural disaster, those are often also experienced interpersonally. So other people may experience it at the same time. Um, but also how people get support and resources from their social environment makes a really big difference. So, in terms of whether people go on to develop PTSD, what we know is there's something called natural recovery. So, in the first roughly 3 months, 12 to 16 weeks, many people, after they've experienced an acute traumatic event, will have symptoms that look very much like PTSD. So, they're having intrusive thoughts and memories about the trauma. They're emotionally upset when they think about it. It's coming to them when they don't want to think about it. They're having dreams or nightmares, or they have a physiological reaction like racing heart, chest tightness when they think about it. Um,
Hmm.
but if they and they might, initially try to not think about it. And they might be having trouble sleeping, trouble concentrating, being a little keyed up, kind of on the lookout for threat. But for the vast majority of people, if they don't avoid, if they don't numb out, or they're not misusing substances to try not to feel their feelings, if they're not withdrawing from their social network, if they're not engaging in a lot of self-blame, I woulda, shoulda, coulda, then this wouldn't have happened, and they're kind of getting back into their lives as usual, those symptoms will abate on their own, and they'll experience what we would refer to as a natural recovery.
Mm-hmm.
However, as we talked about, some subset of people, those symptoms do not come down or remit on their own. And so in that case, we might consider the fact that their process of natural recovery, which everybody has within them, the potential for natural recovery, but in some set of folks, their process of natural recovery has kind of stalled out. And it could be for those reasons that I was mentioning. They're avoiding, they're numbing, they're engaging in unhelpful ways of thinking. And so, our thinking is, if you can recruit indigenous sources of support, like people's close relationships, you can use the relationship to directly address those three impediments to recovery. So
Mm-hmm.
instead of people avoiding, you can enlist close others to help them approach, and especially having them approach things that would help them relearn a sense of safety, but are also reinforcing unto themselves. So going out and doing fun things. So going to sporting events, going to parks, parties, going on trips, things that are kind of intrinsically positive and rewarding. Another thing that the involvement of the social network can help with is helping people feel their feelings. So instead of numbing, you're helping them do the opposite. So again, what's less important when people talk about the trauma, it's less important that they're kind of getting into the nitty gritty of what happened and when, how, et cetera, but more like, why do I think this happened to me? And how am I thinking? How am I feeling about myself? How am I feeling about other people now? And so in the course of, expressing those feelings, that is helping people not be numbed out and essentially not be frozen. They're experiencing the natural emotions that follow from that. And then the third way the social network can be really helpful is helping the trauma survivor have what we call big picture or balanced thinking. So both about why the traumatic event happened. So for example, we've had situations where when the trauma survivor disclosed, the reason that I am so overprotective or gets so protective and get really upset when our kid is, riding her bike a little, closer to the street than I think, even though other people think I'm overreacting, is because when
Right.
I was a medic, there was a child that I wasn't able to save and she died in my arms. And so, by God, I'm going to do everything I can to keep my
All
kids
of
and
them
all of the
safe.
kids safe. And
Right.
so then the person that's receiving that disclosure can kind of say, oh, I understand that I understand where now that comes from. And but can also be curious and ask questions. So like, well, why do you think it was your fault that you weren't able to save that child, in theater? Or what else was going
Right.
on? And you're helping them have a much more nuanced and kind of big picture or flexible way of thinking about the event that then
Mm-hmm.
has a cascading effect on how people think about their own and other people's safety in the here and now.
Right. So the social construct seems to be super positive, but I could see a lot of veterans that may have done things that, morally they disagree with. So
Mm-hmm.
they've already judged themselves on that event. So it'd
Mm-hmm.
make it really hard for them to communicate that event to anyone.
Mm-hmm.
What kind of things would you say to those individuals to like maybe spark, I don't know, the courage to communicate that event or those events?
Yeah. So one of the things that we talk about, again, most of our work today is with couples. So that's the
Right.
example I'll use. is that we we help plant the seed that it's really important for the recipient of that disclosure. So let's say that's a partner or a friend, to be very curious about what the veteran is going to disclose. And asking a lot of questions, not being judgmental, just really kind of espousing curiosity. And what we try to help both members of the dyad do is to kind of ask questions, and as part of being curious, try to understand the context in which this event occurred. Because sometimes when you're able to take a step back and see the big picture, it becomes very clear that sometimes there were forces outside of the individual that were impinging on them.
Right.
So if, for example, if you are, we had a case once, and actually we wrote this up as a case study that I'm happy to direct you to if you want to, make that a resource. There was
Yes, absolutely.
a veteran who was a medic, and he was, I think he was in Iraq at the time, and he was sent to retrieve a very badly injured enemy combatant. And so they were in the helicopter flying, and then the person kind of woke up and tried to grab the veteran's gun and was strangling him and trying to kill him.
Oh, wow.
And the veteran was doing everything that he could to subdue this person, and nothing was working until he finally put his hand and sort of pushed onto this enemy combatant's chest wound, and that made him pass out.
Hmm.
And he had terrible moral injury from this, because
Right.
his duty as a medic is to
Save lives.
save lives and to help people and not do that kind of thing. And he
Mhm.
suffered for years until he wound up doing the couple therapy for PTSD with his wife. And the wife had an extremely nuanced perspective on this, and through this dialogue was kind of able to say to him, you know, you did what needed to be done essentially in the context of that event. Like, he was trying to kill you, and you were trying to do everything you could to not hurt him, but you had to do what you needed to do to save your life and to save the life
Right.
of your crew. Because until they had that conversation, and he had been able to put the event back in its proper historical context, he had, erroneously concluded that he had bad judgment, he had bad impulse control, and he couldn't trust himself because of what had happened then. And what she was able to help him understand was, no, in fact, it's not that you were out of control. It's that it was the opposite. You were in control in that situation, and your judgment was good, and you did exactly what you needed to do to get yourself and your crew home.
Right. I think the mind's a fascinating thing. It can be scary too. I know personally, like I went through some dark stages in life, and when I was in the darker places, the way I would look at things and events in the history or my past, like I would put a spin on it, I'd make it darker, I'd make it hurt more. And if it wasn't for therapy and these close connection and relationships to be like, hey, no, that's not right, and like correct the way that I was viewing those, then it would have been a lot harder for me to get over for sure.
Right. So I think what you're, kind of exemplifying is that in not avoiding and by talking it out, you were able to see it from a different perspective, one that was potentially more balanced and reality based.
Right.
And
Right.
I would say too, one of the things that occurred to me while you were talking is, when people have when they experience a traumatic event, or, especially in combat, it could be many events all in very short succession, and then over, periods of days to weeks to months, they often feel helpless, and they were out of control. And especially if they have not been able to come up with a narrative about why did this happen. And
Right.
so then they're kind of walking around feeling like this could happen to me or to my loved ones at any time. And so oftentimes when people have a narrative that's really centered on disproportionate amount of blame on the individual, it can often be a way to feel like you were able to exert control in an out of control situation and help people feel less vulnerable going forward. So a lot of the work too is in helping people maybe accept at the time that this happened, there might have been things that were out of your control or out of other people's control. Um, but that doesn't mean that the same level of risk or vulnerability is going to happen now that you're not in that same context.
Right. Which kind of reminds me of the reference to the child and the paramedic trying to save the child. Like they have, they go over the top sometimes so they can have more control of those
Mhm.
situations because of the lack of control in historical situations.
Right. And it's a very difficult thing to sit with, that you may have been in a situation where you, despite your best efforts or your best intention or all of your
Right.
training, there was still a negative outcome.
Exactly. So to dive into a person who's dealing with PTSD issues, I read in one of the journals that sometimes they'll engage in behaviors that inadvertently reinforces symptoms. Do you have any examples of that?
Right. Yeah. So I can talk about that both from the perspective of the individual with PTSD, as well as how their close others can get kind of co-opted into that.
Right.
So when somebody has had a trauma and they haven't been able to fully digest it or make meaning of it, or or tell a cogent story about what happened and why, then they have these, I was mentioning the re-experiencing symptoms or intrusions where thoughts, images, sensations are kind of coming to them out of seemingly out of the blue, or when um they're triggered because something reminds them of it. And I kind of think about it as if there's a jigsaw puzzle and the pieces of the puzzle do not fit together in a coherent image.
Hmm.
And so what's happening is the mind is constantly trying to fit these pieces of the puzzle together, but it's not fitting. So the mind is still trying to fit this square peg in a round hole. Um, that's very distressing, very uncomfortable. It puts people into a state of chronic arousal. Um, and in order to feel less on high, like feel less on high alert, feel less under threat, kind of feel better in the moment, people will avoid things that they think that could remind them of their trauma or that they think could put them in danger.
Hmm.
Or they will engage in what we call safety behaviors, which is part of this hypervigilance response. That's part of the dysregulation of the fight part of the fight or flight response. So some examples of that would be, um, people will not go into restaurants or other kind of enclosed spaces where they feel like they can't patrol the perimeter or sort of control the situation. Or if they do go into a restaurant, they'll purposefully pick a table in the back where they can sit with their back to the door so they can be scanning.
Hmm.
And what's really kind of interesting about that is that helps people feel less anxious in the moment because you feel like you're in control. But ultimately, in the long run, it's just kind of perpetuating the sense of I'm not safe and I have to be
Hmm.
on guard all the time. But then what happens is that also occurs in this broader interpersonal context because people in the trauma survivors close closed environment start getting kind of sucked into that. So it's really common that if a couple or a family or a group of friends are going out to dinner and the host or hostess is seating you, they'll just be kind of this musical chairs where automatically then the veteran with PTSD would kind of go sit and be able to sit in the corner and everybody else is positioned around them. So that's one example of what we're calling accommodation. So
Hmm.
basically, both the veteran themselves is accommodating the PTSD, but also you see this interpersonal accommodation where other people in the veteran's environment are kind of helping to make them more comfortable within their PTSD by colluding in the avoidance. And oftentimes this is inadvertent, or inadvertently participating in these safety behaviors. So we've had a lot of couples, where the veteran will engage in combat parking, where you're back in so that if you're in danger, you just hop in your car, you don't have to back out, you could just drive straight out. And what's really interesting is that this just becomes a family's way of life. So everybody combat parks. And when we would talk to, folks about not doing that, it took me aback for a second that it was the wives were like, what do you mean? He's going to freak out. That's going to cause so much stress. And we're like, wow, it's interesting how the whole family kind of gets sucked into this. Or, in combat, one of the things that helps keep you safe is mixing up your routes so your enemy can't track you, right? And so then what'll happen is people will continue doing that once they're home, and then they start enlisting their family members into doing that. And so then the partners and the other family members kind of also are engaging in this hypervigilance, and they're switching up their routes. And then the veterans asking them, like, how did you go home? And it's like, okay, I went this route today. And they're like, all right, don't do that tomorrow. We're
Right.
constantly calling them. Where are you? Did you make it home? Da, 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 da. And it winds up becoming very much a dyadic experience, even though one person was the one that initially sustained the trauma. It just can kind of like infect the whole system. And so what we wind up trying to teach dyads, it's couples, is teaching them this has become now a couple level phenomenon now where you're both engaging in avoidance. So now you're not going out to restaurants, you're not going out on dates, you're not going to fun things, you're not seeing family, because you're both kind of helping keep the PTSD alive by avoiding or by engaging in these safety behaviors. And so those safety behaviors could be, the combat parking, patrolling the perimeter. We've had situations where, the veteran had all these like 6 different bolts on the door, and the wife was like, well, I think this is kind of silly, but I'll go along with it. All sorts of things. And essentially what we're helping them understand is the PTSD is not just something that lives in you, veteran, right? The PTSD is living between the two of you as a couple or as a friend, dyad, or broader family. And so what we're going to do is help the 2 of you or 3 of you, or maybe in some cases 4 of you, join together to shrink the role of PTSD and essentially try to kick PTSD out of your relationship so that it's not getting in the way between the 2 of you.
Do you think couples, as well as people, may go about it unhealthy because they don't know any better? Like, there's just like this. I feel like PTSD is not so commonly talked about. So, like, the positive ways to dealing with things. Like, I know I have friends that deal with things in a positive way all the time, and I'm like, that's amazing. Whereas, like, I felt like it was something I had to learn.
Mm-hmm. Yeah. So I think what can happen with couples or any kind of close dyads, is not knowing that PTSD is very insidious. And so that when you engage in avoidance, engage in safety behaviors, and you numb out, you feel better in the moment. But people may not realize this is making me, or us as a system, in fact, feel better temporarily, but that long term, it's like kind of entrenching this pattern and making it worse. And there's tremendous pressure on people in the veterans close network to help them feel better. So if a spouse, the veteran would say the spouse, like, you need to change up your route because somebody could follow you, and they're like, oh, that's ridiculous. Well, that can feel really unsupportive to a veteran, right? Especially if the spouse is saying, well, that's really dumb. I'm not going to, just because you want to do that, I'm not going to do that. And so, part of the work in the treatment that we've developed is to provide couple level or dyad level psychoeducation so that the 2 members of this dyad have a shared understanding and can be like, oh, this is the PTSD that's kind of pushing us around. And that what we can do is, instead of trying to get us to, as a dyad, get sucked into this dyad level avoidance and safety behaviors, we're going to do things that are the opposite of that. We're going to approach things. So not only are we going to be able to relearn a sense of safety, but they're going to be fun. So one of the things, that I've done with couples, but also non-romantic dyads, like I've worked with siblings, adult siblings or parent, a veteran and their parent, is say, let's try to have you guys go out and do things together that not only are just kind of confronting the PTSD avoidance, but themselves are fun. Like, every
Hmm.
week, let's go to a different restaurant. And when you go to that restaurant, we're going to just purposefully not have the veteran sitting in the corner. In fact, I want the veteran to be sitting with their back to the door. And then you're going to each week make that a little bit more intense. So maybe you first start out going, Monday at 2, and then you're working your way up to Thursday at 5, and then ultimately, Saturday night, 7 o'clock, it's crowded, and you're kind of getting people to give up these safety behaviors. And then ultimately what happens is so initially it's hard for them, and they have this urge to be, scanning the environment, and they want to try to secure the perimeter and whatnot. But then once they kind of get into the zone of doing the fun thing, they forget, and they're, wow, that was really fun. Or I've had people go to the movies who never would have gone to the movies because, the thought of sitting in a dark room in the middle of a crowded space where you can't control the situation was terrifying. People come back, oh, we saw this movie, it was so much fun. When we were doing our study in Austin, we had, this intensive 2-day retreat version of the therapy where we would send them out on the Saturday night, and we give them money, and we say, we want you to go on a date, and that date should double as an opportunity to approach, and it should be something fun. And I remember we had a couple who decided to explore the speakeasies in Boston, and it was
Nice.
so creative because, it was great for the veterans PTSD because, they were going down into these dark stairways and knocking on the door and having to give a password, and they couldn't control the situation, but it was fun. So it looks different for every veteran and their significant other, but the principle is the same.
Right. I'm just thinking about how many friends I'm really going to help with their mental health by making them sit in the middle of a restaurant in the next like week or two.
Mm-hmm.
So what I'm hearing, it's pretty helpful to have your spouse or your network
Yeah.
informed about your situation
Mm-hmm.
and kind of educated on how to help you. Something additional to that I can speak to personally is the more you avoid and practice avoidance, I felt like my threshold for uncomfortableness got more sensitive, like the
Mm-hmm.
less so the more I didn't do. And it was just like before too long, I just sat at my house,
Right.
Amazon primed everything. If I could order groceries in Hawaii, I would have done it, but I couldn't. But it was like anything that I could do to like just not engage, I would do it.
Exactly. I mean, I think you make such a great point. And so, just as the more you avoid, the sort of lower your threshold is for feeling distressed. When people do the opposite, when they approach, they become more and more desensitized. And then their world can get larger and larger in terms of things that they can go out and do.
Right. Did you ever see any correlation? This is a smidge off topic,
Mhm.
but like, is there a higher rate of PTSD in marriages or a lower rate if someone's married or if they're single, or is that not something that we really know yet?
That is a really good question.
Because in my head, like, I'm thinking, I know personally, like, I wasn't in relationships because when I was deployed, I didn't like the distraction. I seen people who were married or who had girlfriends back home, and there's problems that happen and you see them be distracted,
Mhm.
which made them a liability on certain calls or in situations. So I never wanted to do that. So I was always single. So I never had anyone. But I feel like if I had someone in my life that was consistent, who was able to see me change, then that would have been helpful,
Mhm.
because it's not like a huge shift. Like it took time for me to go from, normal me to what I like to think of as train wreck me. It was like a pattern that started, and then I think the reinforcing of bad behaviors made it go to where it did.
Mhm.
Where like I had high levels, I drank a lot, I was aggressive, I fought, I did that whole thing. And to me, it was just like, oh, this is normal. This is what happens after war. Whereas I feel like someone who's in a relationship, they come back and their spouse is like, hey, something's wrong. You need to get help. So then there's that reinforcement. So I could see it being lower if you're in a relationship opposed to if you were single? I don't know. I was just curious.
Yeah, I think that's a really great question. I think I think in general, if you're in a supportive relationship, that probably lowers the risk of somebody developing PTSD. But
Hmm.
also, PTSD can be really hard on a relationship. And so, it can take a toll on a relationship, or if the relationship was distressed to begin with. And, people coming back and being told, what's wrong with you? You're an angry jerk. It's like you're dead inside. What do you not have any feelings? Like all of those things can kind of reinforce a sense of interpersonal threat. So I think a
Right.
lot of it has to do with the quality of the relationship. And I think both romantic and non-romantic. I remember treating um, a veteran who was not married. He came back not in a relationship, but his family was just incredibly supportive and had encouraged him to get help. And he did really well in treatment. And I remember like his mother coming and joining some of the sessions, and
Hmm.
we were able to kind of help explain to her, what was the nature of his symptoms, of what he'd been doing in treatment, and how she and the rest of the family could continue to support his recovery. And he wound up doing great.
That's amazing. I think that kind of sparks in me like education, maybe those relationships. Cause I had one spouse join and she's like, some people think my husband's a dick
Mm-hmm.
and he's not a dick. He just has PTSD.
Mm-hmm.
And it's because she's informed and she knows it and she sees it. But maybe some of those relationships, if the spouse wasn't informed, that is how they see it. I was talking to a nurse just the other day, and he's divorced now, and it's because of almost verbatim what you said. It's like you don't care anymore. You're heartless. It's like you're empty inside, and it's like he's like I did, and I think he realized right there at the dinner table that I think I might have PTSD.
Mm-hmm.
Like I could see the light switch turn on. And I was like, man, I hope he gets help. But it's
Yeah.
just I feel like it's as simple as being educated. And I was going to ask uh again, slightly off point, but I feel like I've seen it in my close network of friends, and I was just curious if you've seen it on like a bigger scale. Someone who does have PTSD getting in a relationship that may be toxic
Mm-hmm.
because they like that intense, that hard love, hard fight, kind of thing. I know I could see a lot of my buddies that have definitely gotten relationships after having PTSD before knowing what PTSD was and how it was impacting in their lives and their relationships. And usually those relationships end in like disaster. But I was just wondering if you've seen any like connection to that.
Yeah, I think, it's a great question. I think what draws people into relationships and keeps them is like $1 million question.
Right. True.
I, one thing that I think could be going on in some cases, I wouldn't presume to say this applies in all cases, is that sometimes these very high conflict, but like, you know, emotionally intense relationships could also serve the function of what we call experiential avoidance,
Hmm.
where if you are, focused on all this ups and downs and turbulence in the relationship, that can also be a way of distracting from the distress that people might have about their traumas.
So you speak a lot about accommodation. I was reading a few of the journals, and accommodation kind of like sounded like enabling to me.
Mm-hmm.
But I feel like there's some like people care, like I've seen it in my family. My family loved me, but they definitely there was a few examples where I feel like they accommodated or they avoided certain things because they didn't want to upset me, which makes me feel bad now that I put them through that. But we didn't know what was going on. I didn't know how to help them. They didn't know how to help me. Now we're all educated on it. But I was just wondering, is there a fine line between supporting in a healthy way and enabling? And like, where does that line really, I guess, get drawn?
That is, that's like such a fantastic question and something that we've been thinking about for a really long time. And in fact, when I was in graduate school, this was the sort of the topic of my dissertation, in the context of bipolar disorder, not PTSD. And we were trying to figure out when family members make sacrifices, what what is sort of a good or healthy sacrificing to promote the patient's well-being versus you're accommodating. And I think it's very context dependent. And so I think what you have to think about is within the context of PTSD, which we know is often maintained by avoidance and by very myopic thinking as opposed to thinking flexibly about yourself and other people and the kind of world around you. What sorts of things that close others do can kind of facilitate people approaching and having a big picture flexible thinking versus are sort of inadvertently reinforcing avoidance and having a very like these biases toward threat, particularly interpersonal threat.
Mm-hmm.
And the other thing I want to say is I think when people accommodate PTSD symptoms, it's so understandable because many times, and we've published some research on this, people do it for a variety of reasons. Sometimes people do it because they think they're being helpful. So if it
Mm-hmm.
stresses you to go to the grocery store because there's crowds and you don't know who's coming around the next aisle, I'll do that. You can stay at home. That's it's very well intentioned. They're just because they don't necessarily understand the phenomenology of PTSD and how, the more I avoid, I feel better in the short run, but then long run, that's sort of reinforcing this perceptions of being under threat. They don't know that. But there are also times that people will accommodate because of a sense of helplessness or because they don't want to rock the boat and they don't want to cause conflict.
Mm-hmm.
And accommodate, like regardless of the reason that people are accommodating, that does seem to make it more likely that the PTSD symptoms are going to stick around, especially because, in some ways, I think I've been also trying to be better about this with my own language to not seem like we're blaming partners or friends or family members. It's really like both people, like both the trauma survivor and their family members are accommodating the disorder.
Right.
So it's kind of a system. It's really, I have found it as I've thought more about it over the years, I found it more helpful to think about how does the system accommodate PTSD? And so, I would say things like not expressing your own thoughts and feelings because you don't want to rock the boat in the relationship. Um, not going out and doing things that you enjoy as a loved one of someone with PTSD because then the veteran might be anxious because I don't know about your whereabouts or something might happen to you. That's when it starts getting very concerning because then sort of both people in the dyad are suffering and it's more likely that the PTSD is going to be maintained and that long run the relationship is sort of being deprived of the nurturance that it needs to flourish because
Mm-hmm.
a relationship is like having a relationship is like tending a garden. There are weeds, you have to do weeding, you have to nurture it, you have to cultivate it. And if that's being constricted and the positives are going down because the PTSD is taking up so much space, that then is affecting the whole system.
One of the journals summed it up pretty good in one little sentence there, and it was suggesting that accommodation, especially when the spouse or the support structure is silencing
Mm-hmm.
themselves, or what was the other one? Feeling of hopelessness.
Mm-hmm.
That can directly relate to higher levels of depression in that person,
Right.
as well as lower levels of satisfaction for the relationship. And I was like, wow. I'm like, yeah, I mean, it seems obvious, but that's a pretty powerful correlation.
Yeah, I mean, actually, what we found was when the spouse was accommodating the service member's symptoms because they were felt helpless, like, or I don't know what else to do, or because they were trying to avoid arguments, that's when, like, over time, those spouses seem to have higher depressive symptoms. But what we found regarding relationship satisfaction is it kind of didn't matter why they were accommodating, that just accommodating more was associated with the spouse being less happy in the relationship. And that kind of made sense to us, because whether you're accommodating to avoid conflict or helplessness, or just because you're trying to be helpful, this kind of gets back to what I was saying about the tending of the garden, of tending of the relationship garden, that if you're just as a couple, or any kind of close dyad, not able to do fun things that mean and rewarding things that engender a sense of pleasure, positivity, closeness, it's like the relationship is getting more and more constricted, and there's less positives to kind of keep you going.
This is, I'm enjoying this. Like, I'm going through my questions. I'm like, man, we haven't hit on like almost half of these yet. So if you run out of time or anything, please let me know, but I'm just going to keep on keeping on.
No, I'm good. Keep going.
Awesome. So, after that, I was just wondering if we could jump into the therapy, that cognitive behavior conjoint therapy. Like, what is that? Like, what, we've mentioned that a bit, but, I was wondering if we can go into a little bit more detail, like how long is it? What are the benefits seen? What are some, I guess, lessons learned, some impactful insight that you could give to other people on that?
Sure. Yeah. So I feel like I could talk about CBCT for PTSD all day. It brings me so much joy and pleasure, and is just one of the best things I've had the privilege of doing in my career. And it's just so gratifying to see people get better so quickly, and for their, again, we tested mainly with romantic couples, but to see their partners doing better. And then sometimes we've heard stories about people will say how they're getting along better with their kids. And then actually one of my colleagues, I love this, was telling a story about a veteran couple she had treated, that as the veteran started changing and he was walking around less angry, less kind of menacing, he was just kind of calmer, more open, that not only were his wife and kids responding to him differently, but his dog seemed less afraid of him too. So, and it was just so cool how I was having this systemic um, impacts. And then I'd be happy to talk about too, sort of the insights that we've learned from doing it in an intensive group setting, because that also has been really gratifying.
When you say group setting, do you mean multiple couples? Okay.
Yeah, multiple couples at a time, because that worked that worked even better than I expected going into it. And I can talk about what was it about the sort of unique contribution of the group that might have kind of enhanced its effects, despite the fact that it was a briefer version and happened only in 2 days.
Right. Yeah, absolutely.
Yeah. So the cognitive behavioral conjoint therapy for PTSD, so I'll just refer to CBCT for PTSD, is it is first and foremost a treatment for PTSD, that happens to be delivered in a couple or a conjoint format. So when I say first and foremost, it's treatment for PTSD, so this would be, if a veteran comes into the VA or elsewhere and they have PTSD, they could be offered, for example, individual evidence-based trauma-focused treatments like prolonged exposure, cognitive processing therapy, or CBCT for PTSD. All three of those treatments have an evidence base that supports them as a first-line treatment for PTSD. The difference is, PE and CPT, prolonged exposure and cognitive processing therapy, are delivered individually. Also, sometimes cognitive processing therapy is delivered to groups of individuals, whereas CBCT for PTSD, the couple or conjoint therapy, involves a close other in every session. So it's a treatment for PTSD that also is designed to enhance the people's close relationship functioning. And the reason that that's another goal of the treatment, the reasons are myriad. So one is, what we know is PTSD can disrupt close relationship functioning. So among veterans, what we know is PTSD, if you have PTSD, you're more likely to get divorced. You're more likely to get divorced multiple times. It also increases the risk of intimate aggression. So both physical and psychological or emotional aggression in these relationships. And that is can be true not only for people's romantic partners, they also can increase risk of aggression towards children and towards others. I had treated someone who came back, and he then went to college, and he and his roommate, who was also a veteran, probably also had PTSD, were like constantly getting into fist fights. He was going to bars, getting into fights all the time.
Sounds
Um,
normal for someone with
yeah, it's
PTSD.
very
Yeah.
common. Yeah, it's really, really common. We also know, so not only can PTSD, and then we know that PTSD can make it hard for people to resolve conflict with others. So, they have disagreements, they don't get resolved. It can also interfere with people being able to feel emotionally and physically close to other people. So not only physically close in terms of sexual intimacy, but also just kind of physical affection in general. So people will kind of recoil from their kids, giving them hugs or jumping on them, playing with them, and they just kind of retreat into themselves. But then we also know that aspects of the people's close relationships can make a difference in terms of whether or not they recover from PTSD. So relationships that feel more supportive are more likely to kind of help facilitate or potentiate recovery. Whereas relationships that are characterized by a lot of conflict or hostility or low levels of support seem to predict less likelihood of people recovering, even if they get individual therapy for PTSD. And we think that's because it's kind of reinforcing this perception of like, I'm under threat, like I'm under threat
Hmm.
in my close relationships, I'm under threat in my home. My family member and I, or partner and I, are not getting along. But even like putting aside these sort of negative things that might be going on in the interpersonal environment, we also know that even when people are accommodating, and even if it's like they're trying to be helpful, it can inadvertently maintain the symptoms because it's helping keep, and I'll just use an example of the veteran kind of too comfortable in their PTSD. So if the partner is doing things like, we've seen this, like shushing the children, like we once treated a couple where the kids opened the refrigerator, and like some kind of container fell out of the fridge onto the floor. It made a really loud noise, and the veteran hit the ground, right? Like thinking he was, back in Iraq. And ever since then, his wife was like telling, shh, don't make any noise, don't upset your father. Like, and then like, letting the veteran like go into the basement, to the war room, and drink, and
Yeah.
it was just keeping the whole thing going.
Hmm.
So for all those reasons, and of course, we know that PTSD is not only hard on a relationship, but it is also hard on the psychological well-being of people in their close environment. So um, the severity of PTSD symptoms in one member of a dyad is associated with increased distress in the spouse and increased distress in the kids, and also parenting issues, both how the veteran parents their kid, but also how they co-parent with their partner. So for all those reasons, we kind of felt like if you can do a single treatment that targets the PTSD symptoms, targets how the dyad relates around the symptoms, then we're going to get an improvement in the veteran's mental health, in the relationship, and improvements in partner well-being, in some cases, children's well-being.
Hmm.
And so that was the motivation for the treatment. So the therapy was originally tested as a 15 session couple based treatment for PTSD, where the dyad would come in once a week for 15 sessions. We found really, really positive effects. So first it was tested in a small sample of Vietnam veterans, and their wives looked really good. Then we got a grant from the NIH to test it in like a much broader sample. So a community sample. So that had some veterans, but also people from the community, and that had more women and people whose traumas included combat, but also non-combat traumas.
Hmm.
And then that looked really, really good. And then there were some other small studies with, veterans and community samples. And then in 2013, the VA central office picked up the therapy, and since 2013 has been engaged in a national effort to disseminate this therapy across the VA.
That's awesome.
Yeah. So, and what's really neat about that is so many providers in individual VAs and CBOCs have been trained in CBCT for PTSD, but also because of telehealth, even if, so if the veteran is in, a VISN, like a catchment area where there is a CBCT provider, they might also be able to get the therapy over telehealth. We've had a lot of people receiving CBCT through telehealth, especially since the pandemic.
Which I think is amazing. I know that I personally have a lot of beef with the VA as well as some of my friends trying to get help. It's like they have bankers hours, and it's like, well, we have jobs, so
Right.
you
Right.
can't really get help from 9 to 5 because we're at work 9 to 5, and then on weekends it's really hard to get anything. And then the telehealth helps a lot too because I live about an hour and a half away from the closest VA
Mhm.
institute. Sorry, side rant.
Yeah, well, in fact, a lot of clinics will have like one or two evenings a week
Hmm.
because we want veterans and their veterans individually, or if they're participating in like a couple-based treatment, we want you to work. We want you to live your lives. We understand that
Right.
people are busy. And so I know I have a lot of colleagues who work in the VA who do, one or two evenings a week to accommodate the veterans' schedules. But one of the things that we found was that because of the like banker's hours issue, that a lot of it was becoming hard for, particularly with the couple therapy. I mean, but I think this is also true with individual therapy. The dropout rates are also high. I think probably about a third of people are not finishing treatment. Um, has kind of there's been a zeitgeist in the PTSD treatment field to make treatments either briefer or to deliver them intensively. So there's now many studies showing that prolonged exposure or cognitive processing therapy delivered in what's called a masked format. So
Hmm.
instead of people coming in once a week for 10 or 12 weeks, they come in every day for 2 weeks and they get the same benefits. And but what's really fascinating is that the dropout rates are a tiny fraction of when people were supposed to be coming in, for an hour, hour and a half once a week, because this way they can just, especially if they're like in the military, they can just get leave, like approved leave. They come
Hmm.
in for like, and they do this every day. And so it just becomes like part of their schedule, and then they just get done in 2 weeks or 3 weeks. And
Right.
then so we started having similar thoughts about CBCT for PTSD, because in most VAs, the hours are like 9 to 5 or 8 to 4:30, and then you have to coordinate not only the therapist schedule with them, but like two members of a couple. And
Right.
so we started, thinking, could we deliver this with less content? So instead of 15 weeks worth of material, could we do 7 or 8, the first 7 or 8 sessions? And to make it more efficient, could we deliver it over a weekend so that people don't have to take time off of work, or they just come in and do it? And then to make it more scalable, to be able to reach more couples, could we deliver it in groups of couples?
Right.
And it worked much better than I expected.
Mhm.
I thought, well, we're giving them less content and they're getting less individual attention per couple or per dyad. But what we found was that doing it intensively just kind of like ripped the band-aid off. People are like, oh, wow, like this totally makes sense to me. And the partners think, now I understand why they, have PTSD and why this is affecting our relationship. And so they're getting that, like, it was the symptoms were making sense to them, as well as
Mhm.
how the symptoms could affect the relationship, but also the skills that we were teaching people, they could be applying literally in that moment intensively over the course of 2 days, that by the end of the treatment, they were already, experiencing so much relief. But then the other thing that was really special about doing it in a group, whereas although I had initially thought about doing it in a group to make it more scalable so we could reach more couples, there was this very powerful thing that was happening that, and I think you'll resonate to this with the
Yeah.
normalizing PTSD. It was normalizing because what they realized, we're not the only ones that have this. Like, yeah, the content was applicable to all the couples. And then, they would practice they would go off and practice their skills, as just with them and their partner. And then they would come back to the group and report on how it went. And it was people were like encouraging each other, and there was all this vicarious learning. And it was just fascinating to me when we asked them, at the end of the 2 days, what was this like for you? And what was it like doing this with people that you didn't know beforehand? You guys didn't know each other a day and a half ago.
Right.
And they would say, and it was so cool. I remember this one service member saying to another, I can see how much you guys have changed in a day and a half or 2 days,
Right.
even if you can't
Mm-hmm.
see it. And so it was just very powerful, and I think reinforcing for each other. I think there was that social support. And I also think doing it in a group with people that you didn't know before, while initially intimidating,
Mm-hmm.
I think was also a really great um, opportunity to kind of um, relearn a sense of safety, because we were telling them, okay, we don't want you to sit in the back of the room and try to be on high alert for threat. We were having them move around the room and having to talk to other people. And they're like, oh, this is kind of fun. This isn't scary. I am safe. And then they started generalizing to just kind of being out in the world in general.
Right.
So what they were learning in the group was, oh, the other people that I'm, in this small room with are not dangerous. In fact, they're supportive of me. We could be friends. So then the next time they're going out into the store or they're going to a restaurant, they're just less primed to assume that other people are inherently dangerous.
Right. On a personal level, like I can just see the logic, like how this makes logical sense. Like if you wanted to do a diet or, exercise more, doing it by yourself, you it's going to be challenging. But if you get a
Exactly.
group and have someone there to hold you accountable, who's there and be able to be like, okay, now we're all going to go, then it's easier to go and it's harder not to, as well as I feel like in relationships or even with PTSD, you feel like you're unique. You feel like you're alone. You're the only one in the world that has these symptoms. Or if you're in a relationship, it's like, oh, my spouse can't possibly understand what I went through. Or in
Mm-hmm.
the spouse's perspective, they're like, that individual can't understand or have any idea what it's like to be in a relationship with someone with PTSD. But then they go in
Mm-hmm.
this group environment and both of them get reassured that they're not unique, they're not alone, that there's other people that they didn't even know before that day that have those exact same experiences. And they're like, okay, wow, we're not alone. So then, like, there's not that weird feeling of like, it's such a unique experience. It's like, okay, how do we get better as a group?
Exactly. This is it 100%. And when we would, show some slides kind of explaining this, and they would say to us, oh, like that's us. Like I can totally see that applying to us. But then it's like, we wouldn't have had those slides in the first place if this wasn't such a common experience.
Right.
So it's exactly what you're saying, that it totally normalized this and helped them feel much less isolated individually and as a couple. Like their experiences are not so unique in that way. Like it's very common.
So one thing that stood out to me, immediately after CBCT, like there was benefits, but it looked as though the benefits increased a lot at the 3 month mark. Do you have any ideas like why that is? I mean, I do. I just want to see what your ideas are.
Yeah, but actually, I'd love to hear your ideas about that.
Okay, so like personally, I think like the more you reinforce bad behavior, the more bad behavior you get. I think it's as simple as that. The more you reinforce positive behavior, more that you do positive patterns. Because I speak to a lot of different therapeutic practices, and they all use different words, whether it be conditioning patterns, like they'll all use different descriptors for it, but basically it just means like do good things, you get good results,
Mhm.
so I feel like the more the educated group is, especially if you did it in like a group of couples. One, they have these connections with individuals that they can reach out for support and be like, hey, have you guys experienced this? Be like, yeah, what did you do that worked? And it's like, boom. Then they have like a better idea to improve their own situation, as well as they're connected on a personal level and both educate and be like, okay, so now we have positive ideas on how to deal with this in a healthy way, whereas before they may have been accommodating or enabling
Mhm.
opposed to actually supporting.
Exactly. So you hit the nail on the head. That's exactly how I was thinking about it too. So what allowed us, with the intensive 2-day format to do it in 2 days is that essentially the treatment followed the patient home, right? And so they started getting, they got better. The symptoms, dropped by the time we checked in with them a month later. But then by 3 months, the symptoms were even lower. And there were also increases in positive things by 3 months because it became, I'll use a borrowed phrase that one of my colleagues taught me, a virtuous cycle instead of a vicious cycle, right? So
Mm-hmm.
as the veteran or the service member with PTSD was having lower and lower symptoms, the relationship is also doing better and better. Or as the relationship is doing better, they're changing the relationship, the symptoms are going down. And then I think the reason we saw also the improvements in the spouses showed up at 3 months, and we think it was because of this virtuous cycle idea that basically, after it took a few months for the whole system to change, then you start seeing the relief in the partners.
What are some examples of the virtuous cycle? Like some things that people could add into their routines that may be positive, because I know some of the things that you discussed in the journals was like improved communication. Some things that have been asked to me personally was like, how do I not take that depression, sadness, or aggression personally, being a spouse of someone dealing in a relationship? Because it's I imagine over time, I don't imagine, I know over time, someone with PTSD does improve. They do get better as long as they put in the work and they're like purposefully working toward improvement.
Mm-hmm.
But it's not going to happen overnight. There's still going to be days where they're depressed, have suicidal ideations, things of that nature. How does a spouse not take those personally?
Right. So I think, what you're getting at is, we refer to as the attributions. So
Yeah,
what is the reason that the other spouse, or it doesn't have to be a spouse, friend, family member,
right. Support group.
how do they, what is the reason that they're giving for why the veteran is behaving this way?
Mm-hmm.
And when people, and my colleague has done research on this, that when in context of romantic couples, when spouses make internal, what we call internal attributions, those relationships tend to be more distressed. So when spouses say, you know, your, when they attribute anger and irritability, and kind of being keyed up or on edge as these behaviors that I'm seeing are because you're a jerk, as opposed to this is PTSD related hypervigilance
Mm-hmm.
that is understandably going to make the spouse themselves feel more angry or more anxious, right? Or
Mm-hmm.
if they're attributing the emotional withdrawal and numbing and the lack of intimacy and the lack of connection to, you're just a cold, unloving person, or what could also make them feel bad is, oh, maybe they're like this because they don't love me anymore. There's something about me that's unlovable. That can also be very distressing to spouses.
Right. Right.
Um, so what we have found helpful is providing what we call psychoeducation. So kind of education about the condition and its impact on relationships, or how it lives in relationships, I should say. Providing that to both the veteran or service member and their close other helps them have a shared meaning making of what's going on. And then once they have that in place, then you kind of are helping them join up as a team for how they together as a unit are going to work to shrink the role of PTSD in their relationship through the application of these different skills. So I think, my bias is to doing that education conjointly rather than individually, because even if what we don't want to do is say to a spouse or friend or other, significant other, oh, don't take it personally, it's their PTSD. What I don't want to just stop there. I don't want them to think, well, I have to keep going along with this, because
I
ultimately
was about
that's
to
not going to
say,
be good for either member of the dyad, which
yeah,
I
that's the
think is,
bad end of accommodation or
yeah,
enabling. It's
yes.
like that doesn't make anything better.
It can help them be less distressed about it. But ultimately, what we want to do is we want to change the whole system. So now that we can make different attributions, and so we can not, we're aligned instead of being adversaries around this. If we can join up as a team, then as a unit, we cannot, as a unit, we can stop accommodating PTSD by doing the opposite. PTSD makes us want to avoid. Well, we're going to do the opposite. We're going to approach, we're going to go out, we're going to do things, we're going to be direct in our communication. PTSD makes us want to engage in safety behaviors. Well, instead of combat parking, I'm going to do regular parking. Instead of arranging the seats in a restaurant so the veteran is sitting with their back to the door, to the wall, we're going to have the veteran sit with their back to the door, and we're going to just go out as normal.
Right.
And so, shifting those attributions, I think, is a really important first step, but I never want that to be where it ends.
I see a lot of people who I just speak when I say a lot of people, I mean like veterans in my community who will just they're like, I'm not aggressive to my spouse. I'm not, I don't say or do mean things. They just get quiet. But
Mm-hmm.
also, it kind of reminds me of something you said earlier, like how the dog, even the dog was reacting differently, because I feel like a lot of people don't realize, and I don't mean to make it sound woo woo, but it's like they put off an energy that is so noticeable to everyone around them, whether it be like super sad or super aggressive. They may not say or do anything. It's just apparent, like I could see it when they walk into a room and I'm like, oh my goodness, this guy, and it's like, it's nice that in a group setting that they could become aware and other people can be like, yeah, we see that.
Right. Well, we're biologically hardwired as human beings to have close relationships. Like that's how we've survived as a species. And when people are emotionally numb or they're withdrawn because of the PTSD, that's people, other people are reacting to that. And it makes it harder for the other people to feel close to them, which can be distressing. And so then what can happen is, in order to try to feel connected to let's say a veteran who's withdrawn, their family, friend, partner will try to engage with them, but that might be uncomfortable for the person with PTSD. So they withdraw more. So then the other person kind of tries to approach them even more. And then you kind of get into this almost like a tango, right? Where one person's
Right.
taking a step forward, other one's taking a step back. And then you can get into this, what we would call like pursuing distancing or demand withdrawal reaction. And
Mhm.
that ultimately sometimes then the person who's being pursued can kind of lash out, like, leave me alone, because they don't know what else to do to get that space. Right. So, what we find really helpful is not just explaining that to a veteran in isolation or to a family member in isolation, but doing that together. Again, providing that education conjointly helps them have now a shared understanding where they can take the blame out of the veteran and put it on the PTSD,
Right.
and then think about, okay, now how are we as a unit going to keep doing things to make it inhospitable for PTSD to live here?
One of the questions I think I should ask earlier, if you're a spouse and you feel like you're in a situation where you may want to get more information on this, where would you suggest to them to go get more information? Or if you're not 100%, but if you're like really positive that, there's something going on here and you want to get help, how would you suggest that to maybe a spouse or a friend or something like that, that just may be closed-minded to that? Because I'm a firm believer you can only help people that want to help themselves. But if you're in a situation where an individual just may not be aware, how would you nudge them in a healthy way to
Sure.
get help?
Um, right. Again, recognizing that you can't force somebody into treatment.
Yeah.
Um, but I do think it's also important. I do think, you know, people's people in supportive relationships are more like, I think there's research that's also showing they're more likely to enter into PTSD treatment.
Mm-hmm.
So, a couple of resources. So, the National Center for PTSD has a link for friends and family. So, both how to engage in their own self care, but then also how to respond supportively to the veteran with PTSD, to express that support while also kind of encouraging them to get help. There's also a program through the VA called Coaching into Care, where that is a significant other of a veteran who may have PTSD can call and get information about ways to be supportive and help grease the skids to make it more likely that the veteran might enter care.
I didn't know about any of those references. All the references I'll add into the show notes
Mm-hmm.
for sure. So it'll be easy accessible. It'll just be a hyperlink so they can just click on it and go straight there.
Yeah, the other thing I think would be important for any clinicians or providers who may be listening to this is that
Mm-hmm.
we've also found the assessment process, even if someone is coming to you for an evaluation for possible consideration for treatment for PTSD, we have found it really helpful to invite them to bring a significant other, whether that's a romantic partner, friend, parent, sibling, family member. We will invite them to come in and share their perspective. What symptoms are you seeing? And explaining to the veteran, we find it really helpful to kind of hear not only from you, but also people in your close environment, like how PTSD is kind of living in your life and exerting its influence. And we've had success then that sometimes then that has opened the door to the significant other participating in CBCT for PTSD with the veteran, even
Mm-hmm.
if initially the referral or the consult was for individual treatment. But even if that veteran is going to pursue individual treatment, involving the significant other during the assessment process and then periodically inviting them to participate in treatment can also help reinforce the gains once the veteran, is at home and doing their work outside of the sessions, and just kind of reinforcing staying in treatment even though sometimes it might feel hard.
Which reminds me, I think it's a fun thing to ask, but there's people I guess, have listened to some of the episodes that I released that don't have PTSD or things of that nature, but through these mental practices, and then I feel like they even get benefit out of this stuff too, So it's not just benefiting someone with PTSD. Like if you add healthy habits, it's going to improve your life, even if you don't have PTSD. So I thought that was a pretty fun thing to see happen in the last couple of months of this. But now I'm going to ask tough questions, the ones that they made me uncomfortable to even write, but I feel like it's important to hit on. But toxic relationships, I feel like there's a different sides of the coin here. So one, if you have toxic relationships, whether it be friends, spouse, uh, things of that nature, can that negatively impact your PTSD and getting healthy, uh, I guess, mentally with PTSD?
Absolutely. And there are multiple studies that show even when people are in what we call evidence-based treatment for PTSD, if they are living with someone who's highly critical or negative, or they just don't perceive themselves as having a lot of social support, or worse, there's what we call negative support, where they're constantly being criticized. Why did you do this? Why did you do that? Well, it was your fault that this thing happened to you. They are less likely to make gains in
Mm-hmm.
in their PTSD. So that was, again, one of the reasons, motivations for doing a conjoint treatment for PTSD, because not only can the close other be a source of support and reinforce the changes that we're trying to promote for people to recover, but also, if the relationship is very distressed, if you can bring that other partner, significant other, in and help change the emotional tone of the relationship, that is also going to make it much more likely that the individual is going to recover.
If your partner, or I'd even say friends, like close friends,
Mhm.
or maybe a parent, if they're not willing to, I guess, join some sort of environment like that to improve how to be a support person or improve the situation, do you have any, I guess, easy ways or of moving that relationship into another direction, or maybe removing themselves from that situation? Maybe take a temporary time out, be like, hey, let's put some space here so I can get me healthy, so I can be better for us, kind of thing. I don't know really what to tell someone who's in that type of relationship, what to do to improve the situation if the other half's not willing to help or improve.
Right. I think that's a really great question. I think where I come down, and this was very much informed in the course of my
Hmm.
training, by my mentors who were experts in treating distressed couples, or couples where there's a lot of conflict or negativity, is that I always going to come down on the side of health. So in terms of, if I'm working with somebody individually, going to be trying to promote their doing things that are going to be good for their mental health, and trying to minimize uh, things, whether that's, if they're, misusing substances,
Hmm.
or they're engaging in other unsafe behaviors, really try to help them connect up. When I do this, I feel this way. When I do that, I feel that way. And helping people ultimately be able to make their own choices, their own decision about what's going to be good for their physical and mental health.
Right.
When working with distressed couples, we don't presume that, whether it's a distressed couple where one person has PTSD or not, we don't presume that staying together is always the right thing.
Hmm.
What we, again, will say is, we come down on the side of health, and that what we want to do in the course of this treatment is, if both people are committed to putting their best feet forward over the course of in the regular CBCT, let's say 15 sessions, then we just kind of see what happens. And sometimes people have a great outcome, and we've had people say, this completely changed my life. This changed our
Hmm.
relationship. I feel like I've gotten my best friend back. Um, and sometimes they go out, in the videos I sent you, one couple that had participated in our treatment was kind of going around telling their friends about this and
Right.
teaching their friends skills. And that was really cool. But, but not all couples stay together. And that's not always a bad outcome, because what we want is, we want people to be able to be their best selves.
Hmm.
And sometimes that's with their partner, and sometimes that's not with their partner. We don't tell them, not, you should break up. That's not appropriate for us to say that. But all we can do is keep coming down on the side of health. And so we take a very strong stance against very corrosive behaviors in, again, in couples, in dyads. So, basically, if you want to, as part of this treatment, we have to agree, we're not there's not going to be name calling. There's not going to be other forms of hostility. There's not going to be empty threats to leave the relationship. There's not going to be threats of physical violence, um, or emotional harm. And people need to agree to that. And if they can't, then we will say, you know, this was part of the contract that we agreed to, we can't proceed. And I have had cases where when I have had to stop the treatment because the couple was not able, like when both members of the couple or dyad were not able to do things that were consistent with safety, I had to say, okay, now we, after a certain period of time where it was clear that it wasn't going to change,
Right.
I had to say, I'm not able to proceed in treatment with you. I would be happy to refer each of you to individual therapy. Sometimes that has actually prompted the one partner to leave the relationship because they're like, wow, this isn't healthy. And when the therapist finally said, I'm not going to keep colluding in this, that was like kind of a wake-up call that they needed to do something different. So again, all of this comes back to my saying, I'm going to come down on the side of health.
Right. Which the way you described it kind of expressed the flip side of the coin. I came at that question saying like, okay, if my spouse or my family member won't help me, and if I feel like it's toxic, but it can be the other way too, where it's like the person who has PTSD is so stubborn or won't get help or can't, like there's some sort of hiccup there, and that other individual cares deeply about them, wants to help, wants the situation to improve. But if that individual doesn't want to take that first step in getting help, or or it just can't, you know eventually, I don't know how to say it nicely, you have to go your own way, I guess.
Yeah, I mean, we definitely take I agree with you, and we take a systemic approach to this, that we're not only we're concerned with the health and well-being of both members of the
Yeah.
system, or maybe there's more than two people, and we're always going to come down on the side of safety and health.
In your experience, and it's vast, I'm really curious if you've ever seen a couple, or since this is about PTSD, I'll say someone with PTSD. So if someone with PTSD has been sorry, I was doing jujitsu yesterday and I got choked out, so my throat's a little bit sore today.
Yeah, no problem.
If you've ever seen anyone with PTSD, try to get help, do the homework, show up purposefully, and like pursue getting better. Have you ever seen them not get better? I mean, it may not be one therapeutic practice. So it may be like P didn't work for you, CRT might work for you, but if they continue that pursuit, have you ever seen anyone just never get better?
Yeah, it's a great question. In my experience and from my read of the literature, um, in a case where the person is getting a full course of the treatment, it's a treatment that has good evidence behind it. They are doing it faithfully. They're doing they're fully immersing themselves in it. They're doing all their stuff outside of the sessions. I think we can typically expect a half to two-thirds of people to have a really good response.
Mm-hmm.
So the question is like, why are people not responding? So sometimes it's they are like maybe and there could be lots of reasons. There could be provider reasons. So maybe the provider says they're doing prolonged exposure, they're doing cognitive processing therapy, but they're not really sticking to the protocol.
Mm-hmm.
And then that what happens is then it kind of gets diluted and the person's not getting, it's like medicine,
Right.
right? Like if I'm going to take an antibiotic, I need to take,
All of it.
if it's 5 days or 10, I need to take all
Yeah.
of it, right? Otherwise, I'm only going to get partially
Right.
better. So there could be therapist factors. There could also be client factors. So maybe the person is showing up, but then they're going home and they're
Mm-hmm.
drinking afterwards, or they're getting high so that they don't have to feel their
Right.
feelings. So that's a form of avoidance, or they're not doing all of their out of session practice as they're supposed
Mm-hmm.
to. Um, so that could be, or maybe the client is not motivated, so it could be lack of motivation. So they don't want to have to talk about hard things. It could be maybe they're motivated, but they're still so scared that they're engaging in avoidance behaviors. So they're, as I said, misusing substances. Other forms of avoidance could be, people are overworking, certain kinds of addictions, being overscheduled so they don't have to think about all these things and they're just kind of white knuckling their way
Right.
through. And that can be, the people may not even realize that they're doing
Mm-hmm.
it. But then a third reason, which again was the reason, one of the motivations for us to do the CBCT for PTSD is even if the person is they're putting their best foot forward, they're trying not to avoid, they're doing all these things. If they're in a relationship, there could be environmental factors that could be interfering. So if there's a lot of conflict at home, um, or if even absent the conflict, the partner, we've seen this too, where the partner is very accommodating because they're trying to be helpful, but they just haven't had the benefit of that education. So
Right.
we've had a case where there was a veteran who was in a Jeep, and they went over an IED. He was driving at the time, and the person in the passenger seat died
Hmm.
instantly. And so basically, once he came home, he just didn't drive. His wife drove him everywhere. And that worked for them, in the short
Right.
run. And in the case of that couple, the wife also, it was also reinforcing because they were spending more time together, or she really felt like, oh, this is a way for me to show care and concern. And it was really,
Right.
really well intentioned. The problem was, while it was, keeping him comfortable in his PTSD in the moment, he was kind of stuck. His natural recovery had stalled out. So one of the things that we had to do in treatment was essentially talk with them about, okay, so this is essentially helping the two of you accommodate the PTSD by your driving him around all the time, or by having their,
Right.
driving arranged like this. And then what we talked to them about was like, okay, it's so clear you are like love him so much, you care about him, and you want to help him feel better. Let's channel that into something that is getting him to approach things that he's afraid of instead of avoiding. And so then it was like, okay, you still can spend a lot of time together in the car, but now we want him to be resuming the
Right.
driving, or ultimately have her not in the car with him eventually so that he could get used to being able to relearn that sense of safety.
That's awesome. I can't wait to talk to my buddy Lo. Him and I, we were in Afghanistan together, and every time I go visit him, he drives all the time because when we're in Afghanistan, I hit 2 IEDs while driving. So he always jokes and tells
Mm-hmm.
me I'm not allowed to drive. And I'm gonna be
Mm-hmm.
like, I appreciate him being so loving and caring and compassionate, but I'm half joking because he'll probably punch me. But awesome. So
But lovingly, right?
exactly, it's all love. That's about every question I had. There's a couple of one that I was curious on a personal level about excluding TBI from the study. I was just curious to that. I know that some of the symptoms can be overlapping, but I was just wondering if there's another like deeper clinical explanation of why TBI was removed from the McDonald study.
Yeah, and that study was that it's all the same larger
Hmm.
study. There were just multiple papers. So for that study, we did let folks in who had TBI.
Oh, okay.
But it just we excluded folks whose TBI were so severe that it would have made it hard for them to understand what they were
Right.
enrolling into, because then that becomes an ethical issue. Like, people need to be able to give informed consent.
Right.
Or if they were so impaired that they wouldn't be able to kind of take in and practice the skills.
Right. Okay.
And so
That makes
that's
sense.
that's pretty common in most studies of PTSD. But we would take folks with mild, like, it's just so common.
Right.
So we do definitely take folks as long as it's not impairing their cognition and they can still do the treatment.
Awesome. Is there anything that you like to touch on before we jump off here?
Just thank you so much for the opportunity. It's so I feel so happy that any of the work that we're doing has a real world impact. So I am happy to continue to be a resource in any way that I can
Oh,
going
that'd be
forward.
awesome. Yeah, no, I appreciate it so much. There's so many interesting things that I'd really like to dive further into. It's just really hard. It was initially hard to make the connection into your all's world of PhDs and doctors that have all this knowledge. But I feel like once it started, it's like you guys are so supportive and it's really awesome. And I
Oh,
appreciate
good.
all that so much. And with that, we're going to wrap this up. I hope you all enjoyed this. Go look at the show notes. It has a lot of resources in there. If you ever have any questions or anything, hit me up on social media. I'm on Facebook and Instagram probably more than anything. I do enjoy the Twitter, so you can find me on there. And with that, I'm going to leave you guys to it. All righty. Bye.